What would you say if I told you that eating garlic could actually be good to prevent bad breath? I'm Dr. Ellie, and in this video I'm going to talk about bad breath, what it is, the real causes, and what you can do about it so that you never again have to be embarrassed on a date, at a meeting, or when you notice people walking away from you backwards. I want to help you stop bad breath. And in order to do that, I want to explain what it is and dispel with some of the misunderstandings about bad breath. Having bad breath can be a huge social problem. And it can be a problem if you are aware that you have bad breath, or it can be a problem if you're unaware you have bad breath. People don't like to smell bad, putrid mouth breath. Now, the first thing you really have to make sure is that you don't have bad breath because you have a dead tooth. And that would be an x-ray at the dentist, go to the endodontist to make sure that that root canal is done. That would get rid of bad breath. So that's one, if you are aware you have a giant hole in a tooth or you have a dead tooth, get it taken care of. Otherwise, bad breath can be controlled. It is a signal, and this is the only other time where you may want to see a doctor. It is a signal of ketosis, which would be that you have diabetes that's out of control. But most bad breath is caused locally. It's people doing the wrong things. And it's really disconcerting because the trouble is, if you don't understand what bad breath is, you can keep trying to treat it and actually make it worse. I worked for a professor, a dentist, who had terrible bad breath. And he kept a bottle of Listerine in his office, and he would rinse with Listerine multiple times a day. His teeth were bathed in acidity, his mouth was dried by the alcohol of the Listerine, and Listerine used in that way can be a real problem. So I'm telling you, it's not about rinsing your mouth or even cleaning your teeth. And in fact, you should never clean your teeth more than 3 times a day. If you're doing continuous cleaning, continuous rinsing, the chances are that you are actually creating a worse cycle of problems. So to understand bad breath, we have to look at the cause. It's an imbalance of bacteria in your mouth. What on earth does that mean? Well, the first thing to understand is your mouth has hundreds of kinds of bacteria. That's a fairly new revelation for a lot of people. There can be up to 800 kinds of good bacteria found in healthy mouths. We have a dozen or so bad guys. And bad breath, believe me, is not about having too many bacteria in your mouth. It's about having the wrong kind. So if you were to blowtorch your garden, so you have no more grass, no more flowers, what is the first thing to come back? It's the weeds, right? The strongest, most invasive, worst kind of weeds. And if you let them be, they will just get more aggressive, more invasive. You won't suddenly sprout a whole bunch of flowers. So bad breath occurs usually because 2 or 3 kinds of bad bacteria, the real bad guys, are dominating your mouth. And they are discouraging the good bacteria because of the kind of bacteria they are. They are invasive enough to stop the good ones being there. They usually love an acidic, dry mouth. So if you're on medications that dry your mouth, or if you're going through menopause, or you're pregnant, or you're using something like a mouthwash like Listerine that is both acidic and has alcohol. And I'm nervous to say this because Listerine is a part of my complete mouth care system, but it's used in a very specific way so that we gain the benefit of Listerine. And there sure are benefits of Listerine, don't get me wrong. But you also have to know how to use it. And I think this is why there's so much misunderstanding about mouthwash. So hang with me here and understand that you have, if you have bad breath, 2 or 3 kinds of the wrong kind of bacteria in your mouth. What do you do about it? I'm going to tell you, and it isn't that difficult. But how did it happen? Let's go beyond. How did that happen? What occurred? And it's usually just the perfect storm conditions. Suppose, for example, you take a course of antibiotics for some unrelated sinus problem, or maybe you have an inflammation or an infection somewhere in your hand, or you've had surgery on your eye, or it doesn't really matter what the reason is, an ear infection for a child. When you take that course of antibiotics, it is going to affect not only your gut bacteria, which most people are beginning to realize now, but also your mouth bacteria. Fortunately, with the gut bacteria, they usually bounce back quite well. The problem in the mouth is if you are doing the wrong things, taking care of your mouth in the wrong way, at that moment when you are killing off all the good bacteria, you are opening the door for this problem. The way to grow good bacteria is more complicated and not the way most people understand. Most people think if they've got bad breath, they have to kill things. They have to get rid of bacteria. They have to somehow or other clean their teeth more. And it is exactly the opposite. What you really need to do is extend the time between meals when you are not eating or drinking anything. That is the first thing to start doing. And ideally, before you begin that period of what I call mouth resting, it is ideal to end the meal with some xylitol. And this is because xylitol will stimulate a flow of alkaline bacteria, bacteria that's actually at the right pH for healthy bacteria. Xylitol also feeds good bacteria. So at the end of a meal, have either granular, a little bit off the end of a teaspoon, or mint or a piece of gum, 100% xylitol, and then stop eating and drinking for at least an hour. And in that hour, you will be creating the environment, you'll be feeding the good bacteria, and you will be encouraging the bad ones to get out of the way and basically to regrow the grass and the flowers in this garden environment in your mouth, the healthy things that are going to protect you and sweeten your breath. Now, things that make this go faster is actually a good diet. The better your diet, the quicker you will achieve this. And some of the foods that are particularly useful because they actually improve the quality of your saliva are salad vegetables, leafy greens, beets, celery, things that you know are good for your immune system and they're good for your body and your health. They're also kind of watery vegetables that will hydrate you, not with water as much, but with the right kind of water that is inside these vegetables. I won't get into the whole chemistry of this now, but watermelon is a good food to eat. Apples are very good. And certainly, please enjoy part of your meal, garlic, onions, and mushrooms. Those are probably the three main foods that people with bad breath need to eat because it boosts their immune system and it feeds their saliva. And the trouble is, most of those people who have bad breath are going to think that garlic, onions particularly, are the last things they should be eating. So this is a risk. I understand this is a turnaround of your head, but commit maybe a week. Try cooking up some garlic, onions, and mushrooms into some butter and fry them up in a pan, and then keep them in the refrigerator so you can add a little bit to every meal. You don't need a lot, just a little bit at every meal. The other thing that's very helpful for digestive enzymes are some fruits. Pineapple and papaya are particularly useful for upper digestive enzymes. And people with bad breath sometimes have acid reflux. And that is because the acidity of their stomach is not as acidic as it should be. And also they can have the wrong enzymes in their stomach and in their upper digestive tract, so that this creates this sort of cycle of acid reflux. Again, the acidity in the mouth is going to feed these bad bacteria. So those little changes in your diet, have a little bit of papaya or apple or pineapple before you eat a meal. You could have some yogurt. Certainly, if you can buy a whole milk, really good yogurt that comes in a glass container, you're looking for L. reuteri as a good bacterium, not so much for your mouth, although it will help your mouth, but to digest it for your digestive tract, that will help you to digest foods better. And when you digest foods better, you will absorb more minerals, and those minerals will end up in your saliva. So diet, nutrition, very important. Fermented foods, the probiotics of L. reuteri would be my suggestion to try and improve your digestive health. Often people with IBS or digestive leaky gut problems have bad breath. Let's try and get around that so that you get your gut healthy, you absorb better from your digestive tract, and then it ends up in your saliva. As I said, you can cook these foods that are good for you or prepare them and just add a little bit of celery to every salad. Chop it up finely and keep it so that you can just add a spoonful onto a salad. It's not the quantity of food that you're eating, it is the variety. And many people with bad breath are on diets that are too restrictive. Bear this in mind rather than saying you can't eat things. Try and widen the focus of your nutrition. And then the last thing, of course, is using my complete mouth care system. If you have pocketing, if you have periodontal disease, you can have almost like a pus in the pockets around your teeth. If you get going with the products that compose my complete mouth care system, I have a free booklet at my website, drellie.com. And you can buy these products. They're not my products. They're in grocery stores. For people who think I am, somehow paid by these companies, I have absolutely no relationship with any of these product companies. I have just recommended this system for 50 years. And it is an amazing way to change your mouth health rapidly. Along with good flossing type toothbrushes, I did not say flossing, I said a flossing type toothbrush that you will use to massage your gums. It's far more effective than any kind of flossing, which I am not going to recommend or get into in this video. Just use the system as I recommend. Be very meticulous about how you use it, and you should start to see, feel, and even breathe better results within 4 to 6 weeks, if not quicker. And do share this with others. Tell people that you actually were able in however many weeks to stop a bad breath problem that you had had, sometimes for decades, sometimes generational. Because these bacteria can be passed from parent to child, from child to child. They are transferable in the liquids of our mouth. I hope with these small changes, you will find relief and you will find a whole new social life out there as a result.